Good afternoon, everyone. Thank you very much for joining us for our Improvement Showcase today. So we're in Series 3, which is Consumer Engagement and Co-Design. My name is Bodie Thorpe, and I'm one of the project managers here at CEIH. So before we start, I'd just like to acknowledge that the land that we're meeting on here today is the traditional lands for the Kaurna people, and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Greater Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. Also acknowledge that maybe some of you are joining us from other lands other than the Kaurna lands. But here in CEIH in the city, we are on Kaurna land. So at CEIH, our slogan, together, let's create better healthcare for South Australians. Make sure you keep up to date with what we're doing, either by checking out our website or follow us on LinkedIn. There's lots of information about what we're up to. So just some housekeeping for today. This is a recorded presentation. So if for the duration of the presentation, you can keep your microphones and cameras off, that would be fantastic. There is the opportunity to ask some questions afterwards, and during that time we'll turn off the recording so it's a little bit more candid and hopefully engage in some good discussion with our host for today, or presenter for today, sorry. So in this Series 3, Consumer Engagement and Human-Centered Design, we've had some really exciting presentations so far. You can check them out on our YouTube. But today we've got Jane Haley joining us from the Women's and Children's Hospital, new Women's and Children's Hospital project, I should say. And Jane's the Manager of Consumer and Community Engagement with the new hospital project. So I'm going to hand over to her now. Thanks for joining us, Jane, and presenting today. And we'll look forward to hearing your presentation.
Thank you, Bodie, and thanks for the opportunity to come and talk about the consumer engagement work that we're doing with the new Women's and Children's project. I'll just get my okay. So, as Bodie has already pointed out, my name's Jane Haley. I'm the project manager. I'm one of the project managers working on the new Women's and Children's Hospital, and my particular focus or portfolio is consumer and community engagement in the hospital. So the title of my presentation today is What Matters to Me? Building a world-class Women's and Children's Hospital in partnership with consumers, families and the community. It's very, very important for this project and for the Women's and Children's Health Network in general that consumers are embedded and engaged at every level of our business. So we have a saying, you know, from bedside to boardroom. So it's really engaging consumers not only in their own care and not only at decision making, but also at strategic and broader decision making processes as well. I know that Bodie just did this, but I'd also like to acknowledge that the land that we meet on today is the land of the Kaurna people. We acknowledge them as the custodians of Kaurna land, and their cultural and heritage beliefs are still important to the living Kaurna people today. One thing I would like to add to that, and although in 20 minutes I'm not sure I'm going to get to talk too much about it, but I would like to acknowledge the generosity and energy and kindness that Aboriginal people and staff in Women's and Children's have given to our project. They're a significant part of the consumer engagement work that we do, and I would just like to publicly thank them for that. So, excuse me. Just briefly what I'm going to cover in 20 minutes, and this is a big project. You know, it's still 5 years away from being built, but it is a massive, massive undertaking, as I'm sure people will know. So what I'm going to try and do today is not focus so much on the high level strategic processes around consumer engagement, but actually the kind of nuts and bolts of what we've done and what we've achieved in the time that we've been doing it. some of the challenges and pitfalls of this kind of work, which I'm sure a lot of people watching will be able to relate to, because I don't think we're particularly special in that area, but also fundamentally what the outcomes are, because that's the bit that we often forget about when we talk about consumer and engagement and co-design, is we often focus on the recruitment and the consultation part without actually saying, well, because of this, this is what's happening. So I want to spend quite a bit of time doing that if I can. So there are some fundamental things that I wanted to talk about straight up. And when we're talking about building a new hospital, it's very important for our project and for me professionally that the hospital is universally accessible. So anyone is able to access it regardless of their physical capabilities, their backgrounds, their cultural background, their mental health. It's really about, this is a facility that everybody needs to be able to access, and they need to be able to do it easily. And diversity is one of the key factors that we keep talking about in our project, because one of the challenges, I guess, one of the complexities about working in this space is that the Women's and Children's Hospital provides a service to a really diverse group of people. So if you think about, we work with mothers, so antenatal, postnatal, right through to that child's 18. We work with women right through their lifetime, so you have that level of diversity. But you also have a geographical diversity as well. So we service the whole of South Australia, parts of Northern Territory and parts of Victoria. And then you have cultural diversity, Aboriginal communities, refugees, people from diverse backgrounds. And then within that, you have all the human diversity. So making sure that it's accessible to all those different age groups, to all of those different developmental stages, to the LGBTQI community. And I'm sure I've missed some people out. But so if you think about trying to shape a consumer engagement process around that level of diversity, that's I think where some of the complexities are in the work that we're doing. And also we need to provide services for the most vulnerable members of our community, women, children, families. The hospital needs to be a place that is safe, that is welcoming, and that people feel like they can come to in times of trauma and extreme stress. So just before I go any further, I should explain what my what my job is. So I sit within the New Women's and Children's project team. My job is, in a nutshell, to plug the consumer voice in wherever I can. So it's my job to look at the processes both within the project and outside of the project and say, oh, the consumer voice needs to go here, needs to go here, needs to go here. The other part of my job is to link the project with the actual consumers. So maintaining our consumer register, making sure that things move smoothly. And in the end, it's about making sure that those voices, even when they are plugged in, are actually producing outcomes. And that, because I have a responsibility to my consumers to say, well, you know, you wanted this in the new hospital, this is the reason that we either can or can't have it. So I provide that kind of feedback loop back to consumers as well. So you may or may not have seen this. So this is our how to design and build the new Women's and Children's Hospital. And I'll put the link to our website in the presentation so that you can, because all of this information is on our website. Just quickly, we're just about to finish the planning phase, which is the blue part of the wheel, and we're moving into design. So in terms of the planning phase and consumers and community, what we really the focus of that phase was developing the service delivery models and the functional design briefs. And we could very easily do that completely separate to the consumers who actually use it. And I think, you know, some staff maybe would have preferred it that way. But what we've done is worked really hard to get people who are actually using that service to input into the service delivery models and functional design brief, because the functional design brief really describes the space and what we're going to do in it. So we need to have people who have experienced the space to be able to input into that. So what we're moving around to now is concept design, schematic design, detailed design, and that's really the kind of nuts and bolts about where things will go and what they'll look like. And I'll talk a bit about how we're going to engage consumers in those spaces as well. Now, I'm going to try and do something a little bit fancy, so just bear with me. I just want to, people may have already seen this, but if you're interested, this has just gone up on our website, and it's an artistic fly through of what the new hospital's going to look like, just from some very early basic impressions. So the new hospital, if people don't know, will be next to the RA, down in the health precinct at the end of North Terrace there. And so I sat down and I thought, you know, so if the brief is to talk about how it's working and whether it's working well and what we can learn from each other, I thought about, so what are the ingredients that are making our consumer engagement program work? So the first one, I think, is organisational support. And again, a lot of this is going to be preaching to the choir in terms of what you need to make things work. But I think it's still important for us to talk about that organisational support. So the thing that for me, it makes my job infinitely easier is that Witchen has a strong consumer engagement program already for me to launch from. So it's absolutely fundamental that you have a shared understanding of what consumer engagement is, what it's going to look like, what we're going to expect to see as a result. So not only do I get that though from Witchen, also the project team that I sit in, which is made up of not only Witchen staff, but staff from planning and design and accounting and different parts of government, have consumers at the forefront often of their thoughts, which is great, which again makes my job infinitely easier. So people will look at something and say, oh, I wonder if we could get a consumer lens over this, which means that, you know, and they'll come and talk to me and I'll talk to consumers, etc., etc. And yeah, so also resources and capacity. So one of the things this project decided very early on was that they wanted consumer engagement to be resourced properly, which means you get me. So that it doesn't fall off the agenda. It's very important that it doesn't, it isn't just kind of added on at the end, not tacked on, but embedded in the process. And also, in the end, you can't have community and consumer engagement without the community or consumers. And it's just been fantastic for me in this work to be able to work with a group of consumers who are excited about a new hospital and who are keen to talk about what their experience has been and how they can make it better. It's actually one of my favourite parts of this job. You know, for example, yesterday I was out talking to a group of year fives who were all super excited about the new hospital and had spent significant time planning all these different things that they thought would, you know, and their ability to think about what might this be like for someone who is blind or someone who is in a wheelchair. And so, you know, it I guess it's obvious, but you can't have consumer engagement without consumers, and you can't have consumers without somebody to help organise them. Ooh. My computer seems dead. So, what have we been doing? We have, I guess, one of the key principles to the work that we're doing in this space is that we've tried as much as we can within a big project like this to be as flexible as we can. So one of the things that I've learned sometimes the hard way in consumer engagement is that there is no point setting up a process for engaging a group that doesn't communicate that well, if that makes sense. So, for example, we've tried to set up a number of meetings in the office for different groups of Aboriginal consumers, and were met with kind of stony silence, as my son would say, crickets. So what we did is we went out and we said, well, this is not working. How would you like to be engaged? Rocket science. And they've said, well, we're not going to come and sit in your office and tell you. You're going to need to come here. You're going to need to build relationships, and you're going to need to engage us in a way that's meaningful for us, if that makes sense. So, and one of the things that we did very early on, which I think was significant, was to talk to consumers about what they cared about in the new hospital. So right from the get-go, we were saying, okay, so this is what clinicians care about in the new hospital. This is what you know, government cares about. So what are the things that you care about? And the list that came back were things like parking, in-hospital accommodation, what the outside spaces are going to look like, what the bereavement space might look like, what the play deck, are we going to have a family resource centre, the importance of wayfinding. And one thing that comes up again and again, and I use this example a lot, is washing machines. So for a family that's in hospital for an extended period of time, being able to wash your clothes is actually a really important thing, to feel like you're actually, you know, that you're okay and that you can wash your clothes. It sounds really simple, but it's that kind of minutiae which I think gets lost in the noise sometimes when we're talking about a big project like this. And this is where the consumers keep us grounded and make us accountable and say, this is what counts to us. You know, that stuff, that's all important. But this is what I remember from my time in the hospital, and I don't want this to happen to someone else, or I think this should happen more. So, so we have two formal advisory groups, the Consumer Advisory Group and the Aboriginal Advisory Group. We have a number of other clinical advisory groups. Those groups act as peak bodies. So basically what they do is say, we want to know more about this. And either, well, it's usually me, will go off and get the information and come back, or go off and consult with a group and bring back recommendations, so that it acts as a funnel, so that, excuse me, as it goes up through the levels of governance, it's actually recorded and minuted, so that if, say, the architects or the design team say, oh, what about this? We can actually say, well, we've already asked about this, here it is. So that kind of making sure that the information is connected and meaningful for the people who need it, as well as the people who are creating it. Ooh. So, look, I'm not going to list off the kind of consultations that we've done, except that, as I said before, we really try and match how we ask the questions with how that group like to be consulted with. So, for example, we're doing some work with the Multiple Births Association, and we said, look, we'd love to talk to your people. We're also, because there's only, well, me, what I try to do as well is tap into groups that already exist. And that means that I can very quickly access a large group of consumers and say, what do you think? And they can feed it back to me. So multiple births is an example of that. Going out to schools, as I said before, we're doing some one-on-one interviews with adolescents as a way of informing our adolescent design principles. And I noticed that you had Dr. Hayward from Youth Cancer Service. So that's an example of a group that we've gone out and met with and said, look, we're going to have this hospice. What do you think, you know, what would be important to you in that kind of facility? So just check the time. Oh, I've already gone over. So some of the outcomes, as I said, it's really important that the information that we collect is fed through to the right people. So we use a register so that people can go in and have a look and access the stuff they need. What we're doing is looking at tailored engagement plans so that we're not doing a kind of one size fits all, because different communities have different needs. So as I said before, the Aboriginal community, the other big group that we would like to engage more with is the cold community. So the other part that I haven't really talked about is other parts of the project can come and approach me to do work with the consumers, which is really great. Some of the examples that, as I've put up there, so the ICT blueprint that we've just developed has personas in it that were developed directly as a result of conversations with consumers. And I really like the way that it flows through the whole project. It's not seen as a separate, oh, you know, that's the consumer person, they need to advise us, which I think is important. And the other thing that we do is every 6 months we will do a consumer experience survey. So asking the consumers about, you know, how has it been for you? Are there things that we could be doing better, and are there areas we could be consulting on that we haven't been? And we got back some really interesting points in terms of the things that were important to the consumers that are already representatives were things like communication. So that feeling that they were getting the information at the same time that staff were. And we put some processes in place for that, because the consumers said, look, people know that I sit on this advisory group and they come and ask me, they read things in the paper, they come and ask me about them and I don't know what to say. And that was a relatively easy thing to fix, you know, but there were other things like scheduling meetings and, you know, making sure the processes that we used were useful, but also concerns about the diversity of consumer reps from themselves. So that was an interesting thing too. So we do that every 6 months to measure how things are travelling. I don't really have too much more, but as I said, have a look at the website. A lot of our documentation is on there in the Flythrough artist impression. But look, I think in a nutshell, it's a great example of how from the ground up, from the very ground roots, we've engaged consumers, we've acted on what they've said, we've asked them what they want in a way that is meaningful and understanding, and they can understand. And I think as a result, we're going to have a much better hospital, that our hospital is actually going to reflect the needs of the people who use it. So there you go.
Yeah, thank you very much, Jane. So our CEIH Improvement Showcase happens every Thursday at 1 o'clock. So feel free to join us again in the future. And if you've got something you'd like to share, stories about what you're doing in the healthcare system, please get in contact with us, because we'd love for you to come and share your stories with us as well. So yeah, feel free to get in contact with us at ceih.sa.gov.au.